Have you noticed that when you're stuck in a negative thought pattern, you experience physical discomfort in a specific area of your body? Like how a tendency to overthink can lead to tension headaches? Today, I sit down with Eileen McKusick, a researcher, educator, and the creator of Biofield Tuning. Her master's thesis was called Exploring the Effects of Audible Sound on the Human Body and its Biofield. Learn how Biofield Tuning can help you overcome anxiety, physical pain, and even help prevent cancer by addressing the root causes of imbalance. Stay until the end to find out how you can start experiencing the transformative benefits of therapeutic sound healing today. You're listening to the Born to Heal podcast, and I'm your host, Dr. Katie Deming. After 2 decades of practicing as an oncologist and caring for thousands of patients, I've seen firsthand how our healthcare system places obstacles in your path to true healing. My guests and I will bridge the worlds of Western medicine and alternative healing to help you achieve optimal health. Expect to uncover new insights, share a few laughs, and maybe even shed some tears along the way. But most of all, we'll learn how to heal from within together. So let's dive into today's episode. I am excited to be joined today by Eileen McKusick. Eileen, welcome.
Thanks, Dr. Katie. Great to be here with you.
I'm fascinated by Biofield Tuning, and I've listened to multiple episodes or interviews with you. But I think for my audience, if you could just give kind of a brief, story of how you came upon this work. You're the inventor and founder of Biofield Tuning, but it'd be helpful for people to know how did you land on this work? And then we can talk about Biofield Tuning and all of things.
Sure. I became interested in health and human potential, science and spirituality, just personal growth stuff when I was 18. And I started reading books. And for people in your audience who are of a researching kind of nature, you know that one book tends to lead to another. You sort of follow a trail of crumbs. And my trail of crumbs brought me to vibrational medicine back in 1996. And I had just been reading about how even though life appears solid and we appear solid, and that's really an artifact of perception, and that ultimately everything is fields of vibration, information, and energy. And I remember thinking, well, if we're just fundamentally vibration, then treating vibration with vibration seems very elegant. It seems very logical. And vibrational medicine is making use of color, sound, music, that sort of thing. And I went out and found every book I could on that topic, which in the mid-90s, there weren't a lot to be found then. But I really devoured them. It resonated with me. And then I got a catalog in the mail that had a set of tuning forks for healing in it. In 1996. And I just ordered them on impulse. And at the time I was doing massage therapy part-time and had the clients that I was comfortable with, I asked them if they would be guinea pigs for me and let me play with my new tuning forks. And right off the bat, they really surprised me. Like I thought that if I had a tuning fork, it was a note of C, that it was just going to create the note of C. It was just going to be an input. But what I discovered was that the tuning forks actually seemed to have a conversation with what was going on in the body. I remember in one of my very early clients that he had pain in one of his shoulders. And when I held the tuning fork over the shoulder that hurt, the tone went sharp. And when I held it over the shoulder that didn't hurt, it just sounded like a C. And so I went back and I just kept holding the tuning fork over where it sounded not right. And I just kept striking it and holding there. And after a little while, it sounded like the other shoulder. And he got up off the table and he rotated his arm and he was like, oh my God, all the pain is gone. And we were both stunned because neither one of us had any expectation of it at all. It was very surprising. And people would come back, they would report that they slept better or they didn't fight with their spouse or that they had less anxiety. And then they'd ask me to do that sound thing again. And in pretty short order, my massage therapy practice morphed into a tuning fork practice. But this was in Connecticut in the 90s. And, when I told people that I was doing sound healing with tuning forks, you can imagine the kind of response that I got. I was very skeptical. I was very dismissive. And I just didn't want to be that person that was being perceived as airy-fairy or woo-woo or pseudo-scientific. It certainly, at that time, I never dreamed that it would become my full-time vocation. So I just did it as a hobby, and I did it as a hobby for 10 years, where I'd see one or two people a week and didn't think anything was going to happen. And at that time, I was just holding the tuning forks sort of over the body. I would find different areas that sounded funky and treat them. But in 2006, I started discovering completely by accident that there was stuff going on in the atmosphere around the body. And when I started exploring the atmosphere around the body and making adjustments out there, very dramatic things started to happen. And it started to dawn on me that this is the kind of help people are looking for. When you're stuck in something and you go to some kind of provider, you want to get unstuck. You want to get the relief that you're looking for. And that started happening more and more. And it dawned on me that I sort of almost had a moral obligation to bring it out into the world. But there was still that image issue. And I realized, well, maybe I better go to school and get some degrees and that will help. So I went to college as an adult and I completed my undergraduate and graduate degrees in 5 years. And I wrote a master's thesis called Exploring the Effects of Audible Sound on the Human Body and its Biofield. And that gave me the opportunity to really do a deep dive into the science, to try to understand the phenomenon that I was encountering, how it worked, why it worked, and really ground it in science that we could understand. Part of that was discovering that our body has an electrical system that we don't learn about. And certainly I was not the first person to discover this. In the early hundreds, you could buy devices for your electrical health from the Sears and Roebuck catalog. But there was definitely an understanding of the electric nature of the body many, many years ago. But with the rise of the pharmaceutical industry, we've all been conditioned to look at our bodies and our ailments chemically and mechanically and look for chemical and mechanical solutions. Even functional medicine and naturopathy is largely about the supplements that you take and this chemical model. There was an author by the name of Robert O. Becker who wrote a fairly well-known book called The Body Electric, and also a book called Cross Currents. And that was in the early 80s. And he discusses the body's electrical system and the approach of electric medicine in that. So we know that our body has electric current in it. In fact, there's been quite a lot coming out in the last year, even about the electricity in the body. But what's less discussed is the fact that anything that has electric current running through it has a magnetic field around it. And this is our aura. Our energy field is the magnetic field of the electric current running through our bodies. Maybe lesser known is that magnetic fields actually guide and inform electric currents. And so what I was doing by moving tuning forks around in the field was actually adjusting the way that electricity is running through the body. So if somebody has inflammation, that's a traffic jam of electric current. And anytime you have an excess in one place, you end up with a deficiency in another, and we start to go out of balance. And sound has the ability to interact directly with this electrical system, with the magnetic field. And when we make adjustments there, tonally, positionally, the way energy is flowing through us, many of us, the pathways of our habits got laid down before the age of 3, precognitively, and energy will move along established pathways. So one of the things that I call myself is that I'm a bioelectrician, and I help to rewire the way that electricity is running through the body rhythmically, because everything is rhythmic, right? Your heart is a rhythm, your breath is a rhythm, your digestive is a rhythm. Every single organ has a rhythm. And stressors can knock us off rhythm. What I essentially discovered is that we are self-tuning instruments that were designed to be in harmony, and that the introduction of something as simple as a tone generator, an acoustic tone generator, provides the body with a mirror because it will initially resonate with whatever is going on, like that fellow's shoulder. But then because it's producing a strong, coherent signal, it will entrain the body, and this is basic physics, into a more coherent expression. A strong, coherent signal will overtake and entrain a weak, incoherent signal. And so that is essentially the practice of biofield tuning, is finding the places that in your signal that are off rhythm, that are out of tune, that are maybe flowing in a place that they shouldn't be, and just helping the body to get itself back into order. And when the body is in order and has enough energy flowing through it, it will fix itself.
So that is really helpful just in terms of giving a background and helping people understand what it is when you mean, what you mean when you say biofield tuning. One of the questions that I have is, you described this gentleman with shoulder pain, and it makes sense with like an injury, but I assume this work does not just work on the physical. There's more, what are the other things that you can see that are held in the field, and what are the implications of that?
Well, the biofield, which I would say is our body's electrical system in its entirety, the electric current running through us, the magnetic field around us, is where our thoughts happen. Our thoughts are electric, where are the waves of emotion are magnetic. So everything points to it being what we call mind, our conscious mind, our subconscious mind. It's where our memories are stored. Even though the conventional view says that our memories are stored in our brain, my explorations in the field led me to discover that memories can be accessed through the field. And when I learned that Alzheimer's patients, there are microtubules that are on cells that are seen as antennas related to memory, and in Alzheimer's patients, that these structures are failing. So if that is an antenna within the body, which is retrieving information in the field, it makes sense if the apparatus for retrieval is failing, that those memories might be there, but they're unable to access them vibrationally. So everything is really accessible through the field. So we treat mental issues like mental perseveration. We can find where that's happening. It's not always around the head. For example, I found that most people that I treat that come in with issues with their right hip, they might have sciatica, they might have pain, they might have S stuff going on, have a tendency towards what I call busy mind, busy body, and a tendency to always be thinking about their to-do list, all the things that they need to do, projecting themselves into the future, worrying about the future, and that impacts the right hip. And in my mapping of the biofield, I discovered that there are kind of different states of mind zones. I noticed that everybody who came in that had left shoulder pain had sadness, had grief, had a heaviness, and something like psychosomatic pain. For example, I treated a woman, a little health fair once, who complained that she had just terrible pain in her left shoulder, and she'd had all kinds of x-rays and there was nothing wrong with her. The doctors are like, structurally, there's nothing wrong. So I started investigating, and I discovered that there was a heavy kind of pocket of atonal energy just off of her left shoulder. And I asked her if she'd lost someone very close to her in the last year or two. She said, "Oh, yes, my husband died 18 months ago, and I've just been so sad and I can't shake it." And so I just stuck a fork in that, because the tuning fork acts like a magnet where you're able to actually move heavy energy, as odd as that sounds, back to the midline. And it was a 20-minute session. And when she stood up, all her pain was gone. All her pain was gone. And I remember her sitting in a chair nearby, just looking at me in astonishment. Like, she just couldn't believe that she'd been to all these doctors and all this thing. And I just stuck a tuning fork and went like that. And it was better, right? So that's what we call psychosomatic pain, where it's actually energetic and there's nothing physically wrong. This past year, we had 2 papers published in peer review for a study that we did on anxiety. And we had, it was a feasibility study. It was a small sample group. We had 15 people in it, 13 completed it. Everybody came into this with high levels of clinical anxiety. And they received 3 one-hour biofield tuning sessions over Zoom. And in every single little P graph, you see the markers just go down and down and down. And everyone exited the study no longer had clinical anxiety. Now, anxiety is something that's very rhythmic. It's just very rhythmic. And you think about when you have anxiety, your rhythm is off. Something that's actually pretty easy for us to fix. And we've been working currently, we have a 3-year fully funded study. We're just into year 2 now, where we have 60 people receiving 5 sessions over Zoom. And we have a control group as well, and we fully anticipate the same kind of results. So this is a huge thing. If you have anxiety, you don't even have to leave your house, and you can receive 3 sessions, 5 sessions over Zoom and have experienced a significant mitigation of those symptoms, that you don't have to be on medication for life, that you can just get your rhythms balanced, and can be that easy. Mild to moderate depression, we've been very successful with. I think the biggest thing that I treat is what I call stuckness, is that we all get stuck in different ways. We get stuck emotionally, we get stuck mentally, we get stuck physically, and we need help getting unstuck. And the electrical system is where all of this is happening. It's very easy to find places where energy is stuck and invite it to get moving again. And then suddenly people start having a very different experience of themselves.
That's so fascinating. And the idea of doing it on Zoom to me is like, how does that work when you're working with sound? Can you speak a little bit about that and how you discovered that you can do this on Zoom, and how does that work?
Well, for many years, people asked me if I could do this work at a distance. And I always thought that was the dumbest question, because this is physics. Like, I'm using sound waves on the body. Like, how on earth would I be able to do it at a distance? You know, I kind of had that arrogant skepticism that people get around this stuff. Maybe people who are watching feel that way. And I totally get it. You know, it's a far reach to understand that tuning forks might help. Never mind tuning forks over Zoom, right? So I totally understand that. And I've certainly been in that position myself. But I'm a scientist, and I like research. I like experiments. I like being like, let's try this and see what happens. And back in 2011, I was working on my master's thesis, and I had come across a fellow by the name of Dr. Carl Merritt, who had written this 30-page PDF that I found online that was the history and current status of energy medicine in America. And I went through this whole document, and I followed all these links. And at the end, I was like, I gotta meet this guy because he's so knowledgeable. And I reached out to him, and I explained to him what I was doing. And he actually helped me with my thesis, and he wrote the foreword to my first book, Tuning the Human Biofield. He's an MD. And one day he asked me if I would like to try an experiment to do the work at a distance. And I said, why not? Let's just give it a try. So he lay down on one of his treatment tables in his office in California, and I pretended that he was on my treatment table in Vermont. And by this point, I had mapped the field, and I had learned the language of vibration. So you lie down on my table, I'm going to tell you about your whole life. I'm going to tell you about every injury or sickness you've ever had. I'm going to tell you about the relationship between your mom, you and your mom's personality, your dad's personality. You had a head injury when you were 5. All of this information is encoded vibrationally in the field, and I've cracked the code and figured out how to read it and understand it. So we had no open line of communication, and I started to comb through the field like I do when someone's on a table. And much to my amazement, that pattern of energy and information was present, and I was able to read it. I was able to adjust it. I took notes, and then I got on the phone with him afterwards, and I told him the ages where he had high stress. I told him areas in his body where he had inflammation, organs that were under functioning, things that happen in early childhood, like all the things that I can tell, which kind of weirds people out. You know, you can't lie or hide in this kind of approach because vibes don't lie. And he said, Eileen, all of that is exactly correct. And I felt a state change while you were working with me. I feel lighter. And he had tested his resting blood sugar before and after and noticed a beneficial shift in that as well. So I had to eat crow, and I had to be like, okay, well, I guess I can do this at a distance. And so for months, I practiced, in friends and family. And what it did was when I'm working with somebody in person and I get into something funky in the field, and I'm not sure what it is, I can say to them, okay, I've found a memory that's around 13. It's in the zone where we store sadness. Does that make you think of anything? And people would always be like, oh yeah, that's when my grandmother died or my dog died, or, they'll corroborate it for me. But when I wasn't in contact with people, I had to listen more deeply into the nuances of this vibrational language that shows up in the overtones and undertones of the fork as the vibrational information intersects the overtones and undertones being produced. And it's almost like an invisible ink decoder or a needle on an album. It broadcasts the information. And so I had to go even deeper into that understanding, like that's a breakup, that's a move, that's a car accident. And it really deepened my understanding. And then I started doing it over the phone or on Zoom because I think it's beneficial to have that interaction. And so that's the way most people do biofield tuning now at a distance, is that way. And sometimes when people express skepticism about how does it work? I would say, well, have you ever watched somebody with a beautiful voice on YouTube sing a song and it moves you to tears? Did you have to be there live when that was being recorded? Was sound able to move you just by watching a video? And everyone's like, well, yeah. And it's kind of the same principle. Sound moves us. It can move us to cringe. It can move us to open. It can move us to tears. And we all know that. We all know that, especially music. Most people have musical playlists. Most people are sound healers and they don't even realize it, in the way that they might choose musical selections or sing in the car when they're fussy, or, right? So we already kind of get it anyway.
Yeah. No, I think that makes so much sense. And there's so many things, Reiki at a distance. There's so many things from an energy standpoint that we can do at a distance. It's just interesting to hear your story of how you came upon that, and that actually you came into it with this skepticism, and then were shown through your experience that this really is able to be done via Zoom. And also, what a beautiful thing too, that it makes it so much more accessible for people, that they can find, a biofield tuner who can work with them over distance on Zoom. So one thing that you said about the, time that you said to that woman, what happened between 1 and 2 years ago. And I'm curious, you described certain areas of the body, but then also time. I'm wondering if you can describe this in the map, just how does that work, and how can people gain an understanding of what you're speaking of?
So this is the biofield anatomy map. And this is broken out into, there's down here, and I know this is hard to see, is the timeline aspect of it. So this person is hypothetically 60 years old. So I'm going to find information from their gestation and birth at the very outer edge of their field, because the field is a torus. So what a torus is it's basically it's a bubble with a central channel down the middle, and a charge circulates through it. So we draw up the negative current from the surface of the earth, why grounding has become so popular. And that's a way for us to energize the ascending negative current. We draw a positive charge from the sun down through our head. And so these charges spiral up and down the central channel or the spine. We see this represented in the Vedic representation of the Ida and the Pingala, the two snakes that crisscross going up the spine. And this is what I would call the positive and negative charge. And then that forms a bubble. So the way that the timeline aspect works in the field is that the outer boundary contains information from our gestation. And just inside that is birth. And then as we move in towards the body, we're really reading the timeline. Because as we generate information, each day you are having certain thoughts, certain feelings, certain inputs, experiences, and all of that is electrical impulses in your body, in your brain. And so we're almost like little EEG tickers, EKG tickers, where we're constantly adding the vibrational information of our experience to our memory bank in these standing waves in our field. So the field extends about 6 feet around us, out to the side. So it's like a 12-foot diameter bubble. And if somebody is 60, I'm going to find information that was generated when they were 30 about 3 feet away from them. And this is consistent all the time. Like every person who learns Biofield Tuning learns to read and work with this map. And it's very easy when you're combing through the field and you hit a pocket of dissonance to determine what age that was created. And if it's off the liver, it had to do with anger or your relationship with your father. If it's off the right shoulder, it has to do with saying yes when you mean no, being a caretaker, a giver, overextending yourself. So wherever these things land in the field, we can plot them on the map and identify specifically what that memory or traumatic input was.
Got it. And so, in this, basically, you've mapped over decades of doing this work and just building this yourself. This is really all the work that you've done. And now you teach other people how to do biofield tuning as well. You have other, what would you call them? What would you call someone who does biofield tuning?
They're a biofield tuning practitioner.
Practitioner.
They're a practitioner.
Yeah.
I started teaching my very first group of students in 2010. And it was between 2006 and 2010 that I mapped the majority of the field. And it was really pattern recognition. It was a lot of sort of fumbling in the dark with moments of flashes of illumination where I would suddenly get insight into what was going on. And at the same time, sort of teaching myself this sonic braille as well, this sort of language of vibration. I wasn't sure if other people could do it. One of my brothers asked me, he's like, can other people do what you do? I was like, I don't know. And then with my first group of students in a pilot class, I discovered that everybody could do it. Everybody could find the areas in the field that were distorted, plot them on the map, figure out what they were, adjust the energy, and that it wasn't really even that hard. The practice is really pretty simple. And you don't even have to hear, although you certainly can hear the differences and learn the language. Anybody can feel it in their fingertips when they're going slowly with a fork. The vibration changes. You can even see it in a weighted fork, the way that the fork vibrates differently when it's in this standing wave, this node of chaos. It's really evident. So that I started in 2010, and at this point, we've trained over 3,000 people in the method. I have a team. There's 12 teachers, and we teach both virtually and in person. People do it as a standalone practice, or they integrate it into whatever practice they might already have. Quite a lot of chiropractors, holistic nurses, coaches, counselors, massage therapists. There's many different approaches to health can incorporate this into what they're already doing to augment whatever their skill set already is.
Yeah. Well, and that makes sense to me that this could be such a beautiful tool that can be brought into so many other modalities to help release the stuckness as you describe. And I'm wondering, so, if we think about our voices are an instrument, can people use their voices to tune themselves?
Absolutely. In fact, my newest body of work that's been developing since 2020 is called Sing the Body Electric, with two Australian brothers, Isaac and Toril Corin. And we developed what we call the sonic anatomy, which is the discovery that different tones, different sounds resonate in different areas of the body. And a lot of these sounds are sounds that babies make naturally as they're exploring their own acoustic instruments. And it sounds like goo and gee and ga and ma and pa. And we just finished up a 1-month course with a group of students. And it is an incredibly healing and liberating exercise to do because there are so many places where we get shut down. For example, the sound pa resonates in the liver. And the liver in both Chinese medicine and the biofield anatomy is related to our father and our relationship with our father. I was recently, when I was in Peru, I was in a cave with a group of people and I was leading them through the tones and everything sounded great until we got to pa, and it came out of almost everybody sounding like ah. And that's a sign that your relationship with your father caused you to contract, to shut down, to pull in, maybe to withhold anger or protect yourself from abuse of some kind or another. And that will inhibit the functioning of your liver, just this tension from that relationship. And when you go in and you really direct your awareness to your liver and you send that sound in there, you can help open up something that might be collapsed. You can help release patterns of tension that can enable better functioning and can actually lead to healing of relationships. And so this combination of using the voice from within through this system of resonance and then tuning forks from the outside has the power to really bring people into a state of in-tuneness. And most of us are just out of tune. We're out of tune instruments that have gotten beat up and lied to and had to deal with many struggles, and we don't function properly. And sound can help us to become more coherent, more clear, more centered, more grounded. And then that allows you to expand into your potential as a human being. Because I think part of the problem with stuckness is that people know that they have the potential to be more. I think everybody knows that they have a genius inside, an amazingness inside. This is certainly what I've observed from getting people in tune, is that when somebody comes into their in tune state, they're amazing. And then they have access to this potential that they could not access before. And it really is just about getting everything in order, in integrity, into a beautiful natural resonance that is also in resonance and consonance with the natural world. Because it's super important that we are, we're not of the earth, like we are the earth. We're water, we're minerals, we're mud, we're tide pools. And part of, I think, a lot of the sickness of humanity these days is that we've lost the sheet music of nature and we've just become noisy inside. And then that becomes the experience of our life. But when you become clear and in tuned, then you have much better interactions with people. You have much better interactions with yourself, and you've got a bigger tank of gas to get through the day. You can get a lot more done. We've heard so many stories of people getting over the writer's block or having the energy to bust clutter. A lot of the clutter within our field shows up in the world around us. People who struggle to maintain order, right? We've all had the experience of having the flu, being on the couch, laundry piling up, dishes in the sink. You just don't have the gumption to get things in order. So this helps. It brings the system into its sort of maximum efficiency of flow so that suddenly you can bust that clutter or you can finish that project, can realize your potential. Is something I think we're all encoded and driven to really do.
Absolutely. Well, and I think it's beautiful too, because this is one of the things that I've seen, especially with people who have cancer, is that a lot of these things are unconscious. They're not even aware that they're being blocked by these things. And of course, the lens that I see through the world through is cancer and illness and, things manifesting in people as physical illness. But then there's these other things and they don't even know what it is that needs to be released or, tuned to bring themselves back in. And so I think it's beautiful to hear about this as a tool that people can use without having to know exactly what the problem is, what's stuck.
Absolutely. And even your practitioner doesn't need to know. When I work on people, I will tell you it's this, and this. But you can do adjustments and help to relieve these areas of blockages without even an in-depth understanding of what is going on. People just notice they feel better or they feel more relaxed. A lot of illness that I've observed is tension-based. And I know there are people that argue that a lot of illness is a consequence of exposure to toxins. But I'll tell you what, we've all been exposed to heavy metals. Why do some people sequester heavy metals and be burdened by them and other people don't? And what I've observed is that the personality who sequesters heavy metals has a tendency to hold back anger. And if you think about the feeling of getting really angry and then the tension you have to create across all the membranes in your body to hold that anger back, that makes it difficult for the body to move stuff like heavy metals around and things get trapped. So yes, toxins are a problem, but a robust system that does not have high degree of tension here and tension there, and will process toxins much more efficiently.
Yeah. So it's basically tuning the body to do what it does naturally better and helping people move through stuckness, whatever it is. And, of course, all of us have different things that we've been experienced in our lives or had exposure to different traumas, that everyone has this lens that they, see the world and also hold in their field. So it's beautiful to think about this just in a way of, this is a way to bring you back in tune so that whatever it is that you're dealing with, it's just things flow easier.
Exactly. And, regarding cancer, I just actually lost one of my best friends to cancer a couple of days ago. And I had given her a session. Now, we don't treat cancer in Biofield Tuning. What I've observed is that when disease goes deeply into the body, it goes out of our wheelhouse. And so we don't ever, take on clients that have cancer, because it's just not what this work does. This work is not, I tried everything with Western medicine and now I'm willing to go woo and try the tuning forks. Like, no, this is really a practice to help get you in balance, keep you in balance so that your body doesn't go south hard in some way or another. And what I found with this particular person, and she had uterine cancer and a tumor that grew on the right side of her uterus, was that she had a very strong, what I call inner taskmaster, and this sort of continual running to-do list of, and I had been telling her for years that she needed to get her foot off the gas and her nose off the grindstone because she was just hitting it too hard and too long. And so that's an indication of the body, the energy shifting to the right side, the yang, the doing, the outward going. And so she had this very strong current of energy that ran along the right side of her body that was always compelling her to go and do. And that is exactly where the pathology developed in her body.
So I want to ask a question about that. So you said that you don't work with people who have cancer, but my question would be, people with cancer also have things that are stuck. So even though you're not treating cancer, is it that you won't see, that your practitioners won't see people who have cancer? Or it's just that we're not treating cancer with this modality. We're helping with, the stuckness and tuning you. And the intention is not to heal the cancer. Am I hearing that correctly?
Yeah, that's correct. I discourage people to take on paying clients who have active cancer, because in my research, what I found is yes, it can provide insight into the emotional underpinnings of what led to it in the first place. I think it was very helpful for my friend to understand what the underlying imbalance that was there. It was very evident that that's what it was. But I wasn't able to make any kind of a dent in her physical ailments, right? So certainly practitioners work on friends and family, they're free to do that sort of thing, but we don't want anyone thinking that they can go to see a Biofield Tuning practitioner and become healed of physical ailments. It can help relieve stress, it can help give insight, but it's not a cure the way that we currently practice it. And also it is illegal in the United States to treat cancer with anything other than AMA approved approaches. So that's just not a battleground we want to step into.
Treating anything with sound, treating cancer with sound is illegal. Is that what you said?
Yeah. As far as I understand it, I certainly have friends and colleagues that have come up with cures and gotten in trouble for it. It's a very well protected marketplace for the people that are involved in it. I'm more interested in prevention. That's my job, is to help you to stay in a preventive state where you aren't yourself to be run by subconscious trauma responses that are out of balance, but you can't stop doing them because for whatever reason, at some point you decided your life depended on you engaging in this kind of trauma response solution. And that's the stuckness part. I really see that wherever we get stuck and we're off balance or off kilter and we keep indulging that, that's where the body breaks down. In the Biofield model, your body is inside your mind, not the other way around. Mm-hmm. And so wherever your Biofield, your mind, your emotions are out of balance, at some point or another, the body is going to malfunction in that area.
Absolutely. That makes sense. And I think it's fascinating, this idea about treating cancer with sound being illegal, because I remember this must have been a few years ago. I was interested in sound healing and just wanted to learn about it. And so I went to, it was an organization where they were having monthly meetings and they focused on different topics and they were talking about all these different topics. And so I was like, why don't we talk about cancer? Like, why are we not talking about cancer? And they said, oh no, that's not something that, that cancer, you can't use sound for cancer. And so it's kind of fascinating to me why this is, as I'm learning a lot of things, there's some things that are fascinating that we are not allowed to explore, that there may be benefit. But I think that what I love about what you're saying here is that it's like you're very clear about what this modality is doing. And I also love the idea of getting ahead of it. And this is one of the things that was really frustrating for me as a traditional oncologist and as a healthcare leader, is that, there's this parable of the river, and my listeners have heard this before, but basically I heard it at a meditation retreat probably in like 2017. And this village, one day there was someone floating in the river. And so they rushed out and saved the person. And then the next day there were 2 bodies in the river and they saved them. And next day there were 4 and then 8. And this village got very organized at rescuing these people off the river. And they had, this whole system with boats and pulleys and just amazing rescue operations. And the village elders were praising the villagers. And I looked at my friend who was a GYN oncologist and I was like, this is Western oncology. We are glorified workers on this river, just pulling people out. But what the heck is happening upstream? And then also, why are we not telling them how to stay out of the river? And so your idea of being, ahead of the illness and really helping, this is what all of the work that I'm doing is. I want to get ahead of this. I don't want us to have, 1 in 3 Americans right now get cancer in their lifetime. That is not acceptable to me. And so really getting ahead and helping people understand all the pieces that make them well, from their emotional well-being to working on the biofield, all of these pieces to allow themselves to have the tools to be in flow and not be carrying all this stuff around. Not only because it hopefully will keep you from getting sick, but you're just going to feel better and lighter, like you describe, which I think is beautiful. So thank you so much for being with me here today. If people would like to find you or your practitioners, what is the best way for them to find you?
Biofieldtuning.com has tells you all about Biofield Tuning. There is a Find a Practitioner page. And we also have a store where I've created a line of very high quality tuning forks. I think sometimes people are like, oh, I'm going to try a tuning fork, and they buy a $12 fork off Amazon. That's not a sound healing tool. My tools are very high quality. They're more expensive, but they're really the sort of quality you need to do this kind of work. And I have a YouTube channel too. You just go to YouTube and search my name. And there's lots of free sessions so you can experience, like kind of through Zoom, what it feels like, and just sort of lots of information there. So plenty of resources have been provided if people want to learn more.
That's wonderful. Thank you so much for being here.
Yes, thank you, Katie.
Thank you for joining me on Born to Heal. It's been a privilege to share this time with you, and I hope that today's episode has offered you valuable insights on your journey toward optimal health. Please consider subscribing, sharing this podcast with your friends, and leaving us a review. To learn more about how you can work with me, please visit katiedeming.com. You can find additional resources in the episode show notes linked below, and remember to join us next week as we continue to explore more holistic approaches to healing. Until then, this is Dr. Katie Deming, reminding you that just like me, you were born to heal.